Cerebral palsy is a neurodevelopmental disorder. It is permanent and non-progressive in nature, causing postural limitation, which occurs in fetal or infant brain. CP is classified on the basis of anatomic distribution, type of movement, and functional activity status. Anatomic classification is further subdivided into hemiplegia, diplegia, and quadriplegia. Hemiplegia involves one side of the body with upper extremity being affected the most. Diplegia affects lower extremity as compared to upper extremity. Quadriplegia affects all four limbs, that is, axial and appendicular skeleton. Other forms include monoplegia, that is single limb involvement, and triplegia, which involves three limbs, usually both legs and one arm. CP can be spastic, dyskinetic, ataxic, hypotonic, and also occur in mixed form. In spastic CP, the clinical presentation involves enhanced muscle tone and hyperreflexia. It is split into unilateral spastic, bilateral spastic, and quadriplegia. For dyskinetic CP, patients perform involuntary, uncontrolled repetitive movements. Muscle tone is either increase or decrease and frequently changes over time. It is of two types, dystonic CP and chorioathetotic CP. The child with dystonic CP presents with a faulty posture and enhanced muscle tension, so-called hypertonic hypokinetic. Chorioathetotic CP is characterized by quick, uncontrolled, frequently fragmenting movements, which overlap slow, constantly changing twisting movements. Muscle tone is usually low, so-called hypotonic hyperkinetic. Ataxic CP causes motor coordination loss. In this type of CP, lowered muscle tension is predominant. Hypertonic CP involves reduced muscle tone, which makes the child unable to move. The most common mixed form of CP is spastic dyskinetic cerebral palsy. The gross motor function classification system is a 5-level classification system that describes the severity of motor disorder based on the evaluation of child's independence, particularly during sitting and walking. In level 1, child walks and climbs stairs without limitation. In level 2, child walks with limitation, may have trouble walking long distances or balancing on uneven surface. In level 3, he walks using a handheld mobility device, may use wheel mobility for long distances. In level 4, child can walk short distance with device, may use powered wheel mobility device or require assistance for walking. In level 5, child have no means of independent mobility, has severe limitation in head and trunk control and requires extensive support.